use for influenza applied to COVID right now. A woman came in yesterday. She wanted to go, she has bronchiectasis, which is a pulmonary disease. She wanted to go to her exercise class because it really helps her. And so we talked about, you know, if you're going to do that, make sure that there's no one who appears unwell, for starters. If you're going to go and use the equipment, make sure that you wipe everything down very thoroughly, that you try to separate from other people, you know, 6 feet apart. And, you know, congregating in larger, you know, churches are probably to be avoided, but a small class is probably safe. There are going to be times when people, you know, they go out and they're taking a chance. But I think as long as you do those basic precautions, that's really the best we can do right now, short of quarantining ourselves, which doesn't seem very realistic. And I don't think that's happening much in Alexandria and the Washington, D.C. area.
So there are a lot of questions, thank you, surrounding, you know, and David, you know the village, you know, because you've been a part of my old village back in Alexandria for years, that a huge component of the village is the socialization and the programs. And so we do have a lot of folks that are typing questions about, should we cancel programs? Should we continue with them? I know you mentioned the small groups. And one of the questions that came through also is, you know, why are seniors more vulnerable than other age groups?
Yes, that's the other question. You know, what should be canceled and what should, you know, the airlines are still flying, even though that seems risky. You know, today I heard there was a big tennis tournament in California that was canceled. There was a South by Southwest concert, but those are venues with thousands of people. I think right now, for me to give an exact number would be disingenuous and not accurate. So I think socialization with precautions. For example, I've gotten into the habit of elbow bumping with all of my patients, and while it's sort of cute, it's a way, you know, it's a way of reminding ourselves that, you know, we can be contagious. It's not only through droplets, but we think also it could be on surfaces. So if we touch the surface and put it in our face, that may cause a spread. Small groups, bridge clubs, exercise groups, yoga classes, in communities where there have been no documented cases, or there are people who are not unwell appearing. There's a slight risk, but I think it's minimal. But I think what I'm telling people is, for this week, maybe just batten down the hatches until we get a lot more testing done and we can see what the prevalence is in the community. There was a report of a rector in Georgetown, which is probably 15 minutes from where I am. He was positive. He tested positive, and he had 2 services on Sunday, and up to 500 people attended those services. So theoretically, you know, they came into contact and they're being evaluated. So I think by the end of this week, we'll have a better idea if, in fact, the 1 million tests plus are being deployed and are being used. Because right now, if a person came into my office who had symptoms of COVID, which are also the same as influenza, I would test him or her for influenza. If that test was negative, I would send them to the Alexandria Health Department, who would then arrange for the test to be done. So it's a bit of a task to get it. So it's a case-by-case basis, I think. People should just be very aware. And sometimes just the anxiety of the possibility is enough to say, let's just cancel the meeting. If I was going to say, if it was my mom and dad, I would say, let's cancel things this week and just wait until we get some results from the tests later this week or early next week. I guess if I had to give one answer, that's what I would tell my parents.
I think that's really sound advice. And I'm kind of surprised that physicians, and I hear your frustration about physicians having to send them to health departments to get tested. And I think that's unfortunately universally across the United States a dilemma for health departments and physicians. You're limited
Right.
and exposing more people by doing duplications. I don't know, going to your office and then another office. And so
Yes.
it's
Yeah, and we actually
frustrating.
are screening people, and if they over the phone, and if they have, high fever, if they have cough, if they have a headache or shortness of breath, we would ask them to go and try to arrange for them to go to the Alexandria Department of Health so that they could be tested urgently to save time. Sending them to the emergency room exposes other people, and they probably don't have the test. So that's sort of discouraged. Having them come into my office is another option, but I would put a mask on them. We would test them for influenza, which again, if it's negative, they would have to be tested for COVID-19 at this point.
So what I'm hearing, which is actually a takeaway from this conversation, is everyone that's on this call, all 72 of you, need to look and see where your local testing is for COVID to help your village out and your community. That's an information I didn't realize, and so that's a proactive thing we can do as, the network, is to look and see where it is. We can send our folks, our community partners, to be tested. So thank you. That's really a good takeaway.
Right. At least reach out to them. I wouldn't
Right.
all show up there at the health department because they might
No.
freak out. But yeah, exactly. I think most, Arlington Health Department, most local health departments would be a good source. And then the next level would be the state health department. But it should be more widely available based on what Trump and Pence said last night at the conference.
Okay, terrific. Well, thank you. I know you probably have to
Sure.
split, but we'll listen in if you can, and we do appreciate your time.
Of course, of course.
I think we have, excuse me, one or two more questions for Dr. Gehring, if you
Sure.
have a minute. One of the questions was, what is known about why seniors are more vulnerable than other age groups?
Oh, I'm sorry. Yes, I didn't answer that. Well, with influenza also can afflict people who are older, and I always am concerned when they say, the elderly over 65, and it's like, wait a minute, 65 is not old. I think a lot of times people can be vigorously healthy and 80 years old. So I think the people who are most compromised, from what I can read and digging into the cases of people who've died, they are, people are maybe have dementia, maybe have COPD, emphysema, underlying uncontrolled, poorly controlled heart disease, or diabetes, asthma. So they have maybe more than one underlying chronic illness combined with maybe being frail. So they don't have much reserve. And that's just something that I see, forget about COVID, just see that in the community. That's kind of how it is. People who are frail are more likely to, their immune system is weaker. They can't fight off the infection, can't eat, can't drink. and so they're more susceptible. Frequently, it's also in very young infants, but I don't know that that has been the case with COVID. It seems that younger folks are not affected. So I think as more information comes out about the people who have succumbed to COVID, that's helpful, because then you say, oh, well, wait a minute, I may be 80, 85, but I'm really, I'm active, I walk, I swim, so I think that's the reason for that seems to be affecting the older folks. I mean, the nursing home in Washington State, I think I heard 6 folks who were infected, or 6 deaths there. I don't want to misquote, but it seemed like it was a nursing home in Washington State. Does that answer your question?
Yes, I believe so. Thank you. That's helpful.
Okay.
I heard that the other questions did get answered that I'm seeing on here. But if you have a question that you didn't feel was answered by Dr. Gehring, please go ahead and type it in. Okay, thanks, Robert. 19 deaths. Is that the total death count for the United States at this point, or was that just in Seattle?
20 in Seattle.
20 in Seattle, says Sue. Okay,
20.
Yeah. And if we're following the rates of other countries, this is sort of the beginning, and it will ramp up before it slows. So thank you very much, Dr. Gehring. A couple of questions came to the chat. Thank you, everybody, for typing your questions in. I think this is a good way to keep them organized and make sure we're answering everybody. One of the questions that's coming up for a lot is what COVID-19 support communication are your cities, towns, or municipalities offering you and non-village seniors in your communities? So this is sort of going back to the point that Dr. Gehring made about the testing, is that as information is coming at us almost by the hour. I mean, there's press conferences, if you're refreshing websites like the CDC, local health department. Oops, my speaker's died. Can everybody hear me still okay? Yes, thumbs up. Thank you.
Yes.
Thanks, Trevor. So if to make sure that if you are not receiving those alerts from your local Department of Health, the district, I know, for example, there's an emergency alert system. You can sign up on the government's website to receive alerts. And most of the time it's, like metro outages and things kind of that nature. But they have been updating folks who are opted into that type of communication, more information about the virus as information becomes unrolled or rolls out. Has anybody not gotten communication from their local state or otherwise health department about any of this? A couple of head shakes. Okay. So if you haven't, then I think that's a flag to be that you're in an area where you might have to be more proactive and reach out directly to the local, state, or county government and say, what's going on? What guidance do we need to be following? I think one of the things I've used, DC's been very proactive, but I also live in Montgomery County, which is where there has been an outbreak as well, a couple days before the DC case was confirmed in Maryland. So I've been getting those types of alerts as well. And I think the more I share with, I'm not a senior, but when I share with people that I live with seniors and I work with seniors, then there's a certain people listen to me and want to give me information. So explaining why you're calling can be helpful too. A question that is coming up is about events and what to cancel, what not to cancel. What I heard Dr. Gehring say was that, he might say, I think he said, batten down the hatches for a week. So if you have anything coming up in the next week, a recommendation might be to postpone. And especially if you're in an active outbreak area, until we get more information about testing and where the cases are and things like that. And especially Ted from Northfield Neighbors at Home says planning a luncheon for 317. If anyone else is having really large events coming up in the next week or so, it might be a good idea to consider internally, how you want to handle that. Knowing that most of our members are already kind of on high alert for this stuff. So at least in our case, we've had a couple of events that we haven't canceled, and then we just get low attendance because people aren't that interested in coming out and about for different reasons. Anyone else want to speak to, especially one from the Pacific Northwest area, Sue, or if you had to cancel any events, especially any large events, how that worked at your village?
Hi, my name is Dorothy Pytel. I'm from the Chicago Hyde Park Village on the south side of Chicago, and we work in close partnership with the University of Chicago Medical Center. So we sort of defer to them for their recommendations, and they've pretty much been canceling large events. And in fact, the university sent out an email today canceling the foreign trips, unnecessary or travel, and I think anything with 100 or more people, they're suggesting that they're canceling as a university. So they haven't gone to online courses like some places are starting to do, but I think it's kind of one of those situations where the development, will be adjusted as the situation changes. But that email just came out this morning.
Thank you for sharing that, Dorothy. Yeah, so like I was saying, stuff is coming out. It's like almost a full-time job just to keep on top of all of it. But if you have a partnership, whether it's with a institution, whether it's with a local government, whether it's with a medical or healthcare system, it might be, it's always helpful for me as a social worker if I'm not making the rules. I'm just kind of following the guidelines. That's just a rule of thumb in general that I like to use in my own practice. So if you have a local institution, like Dorothy mentioned, the University of Chicago medical system, that's fantastic. You can say we're following the guidelines as proposed by X, Y, and Z, and we'll, we're modifying them as needed to fit our needs. But that's always a good tactic if you're trying to make some decisions, is following someone else's hard work and rubric that they've done. So thank
I
you.
have a question, if I could ask. I'm not able to type it in and get it.
Sure.
Or I notice it. I have one question. I know that the children aren't affected, but I have the question as to whether they can be a carrier, even though they aren't affected.
That's a very good question. And based on the literature that I have read, they can be carriers. In fact, a lot of people are able to walk around with an infection but be asymptomatic for several days. And so that's the problem. You really may not be sick or feel sick and be able to spread it. So I think, having raised 3 children and even as a physician, they are the ones that made me sick because, they're all over you and they're loving you up. And so whatever they have, they pass on to mom and dad. But I think children can be carriers. Short answer, yes.
Okay, it sounds like we don't know enough to say that they're definitely not.
I don't think so. No, I think, again, it's such a highly contagious virus that, droplets, kids are not immune. Touching surfaces, if the virus is still alive, they seem to have a lower incidence. Or again, I haven't seen any children or adolescents even reported with it. But we have to kind of assume that they can be carriers at this point.
Great. Okay, thank you. And another question that popped out here too, Dr. Gehring, was if you have the virus, are you then immune to the virus and recover?
Yeah, so I think that the answer is probably, in general, yes. But the bigger problem with COVID, it mutates very, very rapidly and frequently. So it's constantly changing. And that's the way the flu is, flu is always changing. And that's why we have to get a new flu vaccine every year, because the influenza A and B change. They change their makeup. And so we try to guess what they're going to be. But if a person has a mild COVID infection, they should be conferred some immunity, that some protection, I would say. I think that's the working assumption at this time.
Okay.
But again, it's only 3 months old. It's only really 3 months. I mean, it started kind of in December, I think, in Wuhan.
Yeah.
So we don't know. We still have a lot to learn.
Indeed, indeed. Thank you very much.
Sure.
So I'm just going through a lot of questions here, which is great. People are asking a lot about, especially, and this is the frail members call, for our more isolated members, so people who, for whatever issue or reason, have more challenge getting out and about in the community. So even getting to a grocery store or a pharmacy to stock up on some of these provisions might be a challenge for them under any circumstances. These people are probably also going to fall in the higher risk category when we look at, who's more likely to, if they contract the disease, have a worse time recovering, if at all, if it becomes a fatal contact. The things that we've been doing at the village is, at our village, at Capitol Hill Village, is setting up sector captains. So our neighborhood, Capitol Hill, is only a few square miles. It's not very large. And we have a pretty dense population. What we've done is put all of the addresses of our members on a map and then use technology to create sectors that sort of divide everybody into like between 15 and 25 households. And then what we're actively doing now, we actually have a volunteer in our office right now who's helping with this, is reaching out to people that we've identified as potential sector captains. But we're going to, once we have the sector captains identified, what we're going to do is have them reach out to all of the different members in their sector, or we might have a co-captain too. So we might split this between a couple of folks. And they will, we're working on finalizing a survey, a pretty brief survey, mostly about following recommendations from the CDC about having certain things on hand, like enough toilet paper, hygiene products, making sure they have soap and running water, making sure they have shelf-stable food, or if they can't prepare a meal, giving them options for meal delivery, and making sure they have a working thermometer, something like this. I can share all of what we've done too with Barbara and Trevor afterwards, so that people can take a look at this. And it's still a working document because we haven't done it yet. We're responding kind of in real time, as I imagine most of us on the call are. If you're not in response, then you probably will be in the next couple of days or week or so. So in addition to figuring out what guidelines you're going to follow in terms of shutting down activities, the second aspect from a village perspective is how are we going to contact our members and how are we going to make sure that everybody's okay without putting ourselves or our volunteers at risk, right? Everyone's safety is priority. And
can I interrupt for 1 second? This is Dr. Gehring. I have to scoot. So I've actually just got a message that one of my patients has been in direct contact with a COVID positive person, so I have to help her. So it is definitely here now, folks. This is my first positive case in my practice. So the more testing we do, I think the more And the last thing I'll say is don't panic. Do not panic.
Thank
Do
you.
not panic. Just keep abreast, have a reliable science-based, fact-based source, not the television, but CDC or the health department, and just practice good, hygiene, hand washing, don't touch your face, and stay, avoid crowds for the next little while, and everybody will be fine.
Thank you so much, Dr. Gehring.
Thank you, David. We appreciate your
Okay.
time.
Yes.
Okay, my pleasure.
good luck.
Everybody. Let's be safe.
Thank you.
Bye.
Bye.
That's
Thank you.
actually awesome. Katie, I want to tail end on what you just said.
Please.
I just talked to my village back in Virginia, Mount Vernon Home, and they actually did cancel programs, and that maybe, that's, for the next 2 weeks, and they'll decide beyond that. But what they are doing, and I know you have a system in place for Capitol Hill Village, you have a lot of members though. For smaller scale villages, what Mount Vernon Home has done is they're tasking the board of directors, and we're going to have a phone tree, and each of them are going to take 4 or 5 members, and they're going to reach out, those who need groceries, those who need it, and actually asking members, if you don't need to go to the grocery store, can we arrange to have Peapod and have the staff do it, deliver it, or have a designated time to go. If you don't necessarily need to have that doctor's appointment, can you reschedule it to, April until, it's a little bit more clear as to the direction, but also find out the vulnerable, but it's also a touch point to say hello and to have an interaction. And actually Mount Vernon Home is thinking about signing up for a Zoom so that maybe they can have, a little, they have this program called Chatters, and they can continue some of their programs, but it's going to be on the computer and they can all talk to each other. So there's viable ways to get around some of the isolation. I'm not talking to homebound folks, but, and this goes for our volunteers too, to protect them. And that's one of the things we have to look at.
Yes, definitely. Thank you. I love getting the board of directors involved in that way. I think that's a fantastic opportunity for board members to get direct, air quotes, contact with a broader base of membership than they might otherwise. That's great. But in any case, similarly, Capitol Hill Village is reaching out, and we have not, as of now, canceled all of our events. We also run about 68 or 70 events every month, so we've got a massive offering, and many of those are very small. 3 or 4 people are going to a certain walk group, or so we have a large number, but not all of them are 20, 30 plus people. We had communication yesterday with all of our group leaders, all of the volunteers who run the groups, and asked them their personal preference, if they felt comfortable keeping it or if they wanted to cancel it. And the majority have gotten back and said, some of the larger ones have opted to cancel. And then some of the smaller ones have said, as long as the space is still available, one of them uses a community area space, we're going to modify, we're going to sit 6 feet apart from each other. We're going to make sure we have hand sanitizer on hand, and we're going to continue to meet. This one specifically was meditation, and everyone was like, we need meditation right now of all times. So we left that up to the volunteers as to whether or not they wanted to still hold the group, and then we're leaving it up to members, of course, as always, whether or not they feel comfortable attending. So we expect to see, as long as we are still holding the events, we expect to see some drop off in terms of attendance because people are taking greater precautions, or someone who might not otherwise be considered vulnerable, because they're a cancer survivor and have had chemotherapy in the past that's depleted their immune system, or they're maybe getting ongoing treatment for something that's chronic but not debilitating, but they might not, want to be putting themselves out there at risk. So we've both reached out to the program directors, or the volunteers who run the programs, and all of our volunteers, informing them of the situation. And what we also have not stopped volunteer help at this point. We are asking that if volunteers have any type of, illness ever, which is normal, right? We usually want our volunteers to stay at home and take care of themselves if they're not feeling well, but we're making, so clear in our communication with them that we really do not want them to be coming in to help it with anything if they have any type of symptoms, and kind of outlining what those symptoms are. And then the same with members, is that we want members to feel like they have the contacts that they need to get help if they need it, and that they should stay home and keep themselves and others healthy too. We're very supportive of that. So going back to what Barbara was saying with the sector captain outreach, it is just a point of contact. It's a light touch. So we're not hoping with this to identify everybody who has the cold or flu or potentially could have the virus. Our purpose is really to let people know through that we have gotten information, recommendations from, like Dr. Gehring said, science-based resource like the CDC and the DC Department of Health. And we are, making sure, because not everyone does use email or check email regularly, that we're calling people so that they're hearing it from us, and offering to do a daily phone call check-in. And that's what the captain sector would do ongoing. Part of what that daily phone call will entail is, how are you doing? And if the person is expressing that they're concerned about health symptoms, or I've run out of toilet paper, or X, Y, and Z, then the sector captain will either self-mobilize or get back with us, the staff, and the greater volunteer community at the village to say, okay, here's an issue that's arisen for so-and-so. They've requested some help. How are we going to problem shoot this? So similarly to how we would operate anyway, except we're not necessarily calling everybody every day to say, hey, how can we help you? What's going on? So in this, it also sets us up, if the village, we've decided that we're kind of also following the schools. And as long as DC public schools are still open, we're going to be open. If the schools do shut down and we do go to remote operations, then we're all going to have, the staff all have laptops. We will continue to support members from our homes, and deploy as appropriate volunteer support in a community. But again, only as following the guidelines that we're following from the DC Department of Health, public school system, and the CDC. Not our own guidelines that we're kind of thinking sounds good. So going back to that piece again too. So I have a lot of
This is Dorothy from the Chicago Hyde Park Village again. We actually had a discussion this morning regarding because the Chicago public schools have essentially said that they're not closing anytime soon. They're just going to do school by school. Right now, there's one school impacted, so they've closed that school.
Mm-hmm.
And we were wondering whether, because some of our volunteers have suggested that be the guideline, and we were wondering whether that's not appropriate for villages, simply because, at least in Chicago, a big urban city, schools have to stay open also because it's really an issue of safety and nutrition in some ways. And if you close those, you really are limiting children from having access to those. And so they might have a higher threshold for keeping the schools open than we, since we're working with a very different population that's much more at risk. So anyway, I just wanted, every group has to decide for themselves, but it's just something that came up in a meeting with us this morning.
Great point. And especially in urban areas like where we are located as well, that's very true. Yeah. We also have a lot of charter schools and private schools who are doing their own thing all the time, regardless of what the DCPS is saying. Okay. So another question is, I am from Sophia. I am also a mayor, and I'm trying to push us to find a way to, yes, and to working to support some community organizations coming together to support seniors beyond villages. Beautiful. How have you overcome sharing personal contact information, etc.? So great question. I would say in general, we haven't had to I have not run into that. Has anyone on the call come into this question of, can you share contact information across networks? I would like to speak to that. Okay, yeah, so it's a very good question, and I think it comes up for lots of different reasons, you know, why contact information would need to be shared. As far as I'm concerned, from HIPAA guidelines, which I'm, you know, bound to as a licensed social worker, that would not be something that I would be able to do, but that doesn't necessarily mean that, you know, if depending on how the bylaws or your membership organization is written, I don't know, could be.
Katie, might I be able to explain?
Hi, yes.
So I noticed I'm signed in somehow under my daughter. My name's Layla.
Oh, hi, Layla.
So the situation is, we do not have senior apartments in our community. We don't have congregate meals in our community as many other municipalities might in our area. But we do have a number of seniors who you know, live in single family homes and in apartments that are not yet members of the village. And the indications that we're getting are actually far more direct and add far more cautions than what the doctor was sharing. Here in Prince George's County, Maryland, seniors are encouraged over the age of 60 to limit contact, to try to stay home as much as possible, and to follow the CDC guidelines as far as preparing to have 3 months of prescriptions and other supplies and things like that at home. And the desire of some community organizations, including our local village, is to come together to try to provide supports outside of village membership, that for seniors to be able to opt in, call a phone number and see if there are community members who agree to pass a background check, to just provide some supports as this progresses, meaning you need something picked up from the grocery, somebody will step forward and do that. So in other words, almost a village writ large during COVID-19. And I am trying to find a way to responsibly as a town and to push our town to do more to support what these community organizations are doing. So my first question is, are any of the villages located in communities that have stepped forward and said, we're going to take care of our senior and other higher risk populations and provide some supports more than merely communication? And just to learn to see if there are other models where communities are stepping forward and during this time doing some more intensive support.
I don't know if there's anyone on the call who answers that. I know there are some villages in general who are simply geographically bound. So if you live in a certain area, you are eligible to receive support from the village. Not all are membership based. Is there anyone on the call who either has that as a model overall or specifically, as Layla's asking, in this?
And this is where you have a town or municipality that is offering support beyond the village. Well, it sounds like we're it, you know, villages are it. So
This is Diane from Northampton Neighbors. We are a membership-based organization in Western Massachusetts. Part of our membership, however, is something called neighborhood circles, where we invite members in a geographic area to gather and get to know each other. And some of them are Northampton Neighbors members and some of them are just members. Tonight, we have our support committee meeting where we will be developing a message to our community to ask neighbors to look in on neighbors, to check on neighbors, to provide services to neighbors. We also are in close contact with our municipality, which is a fairly small city in Western Massachusetts, about how to offer those things safely to, as you point out, to each other and for each other. But we, at the moment, what we were focused on, and why I was late to this call, sorry, is we had some events coming up, some social events, and trying to discuss as a board what our responsibility is to hold or cancel those gatherings. We decided to cancel one for tomorrow night, and the support committee will be looking forward to what we should do into the future, just to mitigate the potential spread of this, and also to do so in a way that isn't you kind of want to be appropriately urgent about this, I guess is the word, and not too fearful or
Right.
fear-mongering, I guess, and also sort of be as encouraging as possible. You don't want to over-encourage contact, but you don't want to, under-encourage it either, and that's our support committee is facing tonight. We want to have some language around encouraging both members and volunteers to say, if it doesn't feel right, you shouldn't do it. And if there are non-essential requests, to sort of hold those until we get a better handle on where our city is. Does that help at all, Sophia? Oh, you're not Sophia. You're
Layla.
I'm Layla,
Sorry, Layla.
and yes, that does help. So it sounds like your municipality, what sort of supports, if any, is your municipality offering?
They are offering, at this point, we hope to approach the mayor. We've had great success with the Board of Health. They worked with us on, as they were developing their protocol and sharing their protocol, so we could work with them. And as far as the mayor is concerned, right now, I mean, he's got a lot on his plate with just, dealing with everybody. What we're faced with here is we're in a 5-college area, and overnight, several of them have decided to shut down their classes. So it seemed like a lot happened in the last 48 hours in a way. So we've been kind of looking at this a little bit slowly and saying, okay, we can talk about it at our regularly scheduled support meeting on Tuesday night. And now it's kind of blown up a bit. So we haven't made that reach out. Our mayor did make a video statement, and there was a robocall yesterday that was primarily about take care of each other and wash your hands. That was, the basis of that message. But that piece that you just spoke about it's big. Like, how do you get 3 months supply of your meds? How do you ensure that you even know that you should do that? I think a misconception for some is, well, I'm fine and, I'm okay, but you might be, but in 3 months it might, or 2 weeks, it might be that those things that you think you could go and get if you were fine might not be there. And that's a tricky piece, right? So I don't have a solution. We're still sort of working through it. I hope to have better words tomorrow after this support meeting for how we're going to support our community. But those neighborhood circles, I think, are kind of key. They've been really helpful in snowstorms and other sort of natural events. So maybe they will be in this too.
So we only have a few minutes left of the call. I want to, there's been lots of chatter on the chat, and I see that Trevor chimed in and said that he can share a transcript.
Oh, great.
People who have shared what they've done or links, etc. That can all be included. And will that just be shared back, Trevor, on the website, or will you send it out to people who registered for the call? How will you do that?
I could send it out to all of our members, really.
That'd be great.
Okay. And then
That's not the only, and just let me try. And there was another question earlier about what the network is going to be doing. Well, we've been proactively sending out, like I just got a transcript from Montgomery County Villages that put together something like a checklist. And I did a checklist earlier in the week. But I'll tell you, the valuable part of what the network has is the forums where people are posting what they're sending out and giving ideas. And so the great part about this interactive communication is that continue to look at it. Anything that you have, you want to share, we're going to regurgitate it back to you guys and send it to everyone, whether it's posted in the forums, whether it's posted on our website. We hope to keep abreast of this as we go along. And I love hearing about not just the villages, but the village movement is about community connections. And whatever we can do within our communities to help this effort within our community is a win-win. You know, it's neighbor helping neighbor. Let's get back to the premise. And so I love what everybody has talked about and appreciate everyone's time. And if we need another webinar, I know Travis loves this, but we will do another one if we have a follow-up, and we need to do one in another week or so to see, you know, if there's other questions or additional issues that we need to address. Just let us know. And you guys are not shy about letting us know things. So.
Thanks, Barbara. So yes, like to reiterate, if there are folks who have documents that they've created for internal purposes, share them with V2V so that they can be included on the forum and whatnot. And that goes for any project that we're working on, really. You know, and before you start creating something, check there first, so you don't have to start from zero and reinvent the wheel. Excellent, wonderful. And Barbara and Travis, I will share with you what our village at CHV has done as we continue to unroll it.
That'd be great. We'd love to share it. And Kate, there's been a couple questions about, you know, I know that everybody's hoarding and there's, you know, places that are out of the hand sanitizers and everything. Somebody in the chat posted, I didn't scroll back through, but how you can make your own with rubbing alcohol and aloe vera gel. And, you know, if you want to, you know, smell pretty, you can add a fragrance, but you can make your own if you want to have a hand sanitizer. But believe it or not, my sister was in Vermont last weekend, and I said, she was at Staples, and I'm like, can you see if there's any hand sanitizer there? And she's like, there were 3 huge bottles and a bunch of little ones. So look at those random places. They're still out there. Some of the, you know, well-known, you know, Targets and everything else. I think you're going to find a little bit more production as we go along of these products. But don't go on Amazon and buy, you know, an $89 bottle of Purell, please.
So the question is how to share documents. Barbara or Travis, what's the best way for folks what's the email address to send documents to?
Travis, I think probably V2V, right?
Yes.
I'll post it in here, but V2V is the best way to send us documents directly. Both Travis and
BTV at vtvnetwork.org.
But I think that's the best way, and then we can send it out. We have Facebook. We have, you know, share it on Facebook. You know, if you have a document, you can, you know, share it on Facebook with us. And by the way, we're not the only ones that look at our Facebook page. We have other senior serving agencies that look at our Facebook all the time. Health agencies, you know, we all work in coordination. Hospital systems, you know, our Facebook is very well, you know, viewed. So
I want to just jump in here really quickly to answer another question that I was seeing that I don't think we touched on, was if you have a volunteer or people who are being kind of just saying, oh, well, I'm going to be fine. You know, and maybe someone who's a very not a risk adverse person, which might make them a lot of fun to hang out with sometimes. But when it comes to something like this, people who are sort of throwing caution to the wind, maybe as a response to some of this like fear mongering that is happening in some of the news outlets, And my response to that would be to say, you know, well, we can't control what people are going to do, but I think it is important that, you know, we say, well, it's not appropriate for you to act that way around our members. You know, we do serve a population that's higher at risk. And so while we can't control or tell you how to live your life, we are going to can't, you know, it's not appropriate for you then to continue doing the volunteering with us that you do until, you know, the outbreak is contained. And I would hope that you could get some maybe good guidance from your board too around how to support if you have volunteers or anyone, you know, staff members, anybody who's not taking this with the appropriate level of seriousness or caution. Okay. Well, thank you everybody so much for the call. Hope to see you next month as well. And we can talk about how this is all behind us. Maybe not in a month, maybe we'll be behind us, but we'll at least be, we'll all be seasoned pros by that point. Yeah, thank you everybody very much. Thanks, V2V.
Thank you.
Thanks.
Bye.
Thank you all.